All righty. Well, thank you guys for joining us today. Just to make sure you're in the right spot where you wanted to be for this hour. Just take a look at the screen. You're in addressing the needs of minority adolescent clients through virtual interventions, bridging the virtual gap. So if you're not in the spot you intended to be, now would be the time to just put your little virtual finger up and head to your spot that you intended to be. If you did mean to be with us here today, I'll go ahead and introduce myself. Let's see. I am Dr. Chanta Moore. Yes, like the singer, except I cannot sing. I spent nearly a decade serving youth and families in a variety of settings. I worked in schools, adult education, and community centers, universities. Currently, I work as a counselor educator and consultant. I also see clients as a contract specialist for a few private practices here in the Houston area. So thank you for choosing to share time and space with us here today. I'm actually here as Robin today, so I'll let Batwoman introduce herself.
Thank you. My name is Jasmine Gay. I'm a first-year doctoral student at St. Mary's University, located in San Antonio, Texas, and I am getting my PhD in counselor education and supervision. I am a licensed professional counselor here in Houston, and I currently work as a school-based mental health counselor for KIPP, Texas, and I also have another job working as a private practice therapist for Heights Family Counseling, located in Houston as well. I know it doesn't look like it, but I have over 10 years of experience working in the mental health field. I've worked with juvenile probation, community mental health, and now I'm in the school setting and private practice.
Awesome. What she didn't mention is this is her very first professional presentation. So let's do our best to make this a positive experience for her because we want her to want to do it again. So we'll jump in. We have 3 goals for today. We want to help you identify barriers to clinical success as it relates to virtual therapeutic work with youth that are situated within alternative placements. We also want to help to increase your understanding of virtual therapeutic interventions that may enhance your work with youth. And we also want to provide you with the opportunity to apply culturally relevant interventions that are creative and effective. Throughout our time together today, feel free to use the chat to share, ask any questions, anything that we haven't addressed that you want to make sure we get to before our time ends today. Feel free to kind of express yourself in the chat. We also want to acknowledge that we recognize that you are experts in your own right, so we genuinely encourage you to share. We're going to talk to you today about some things that work for us, some things that we've noticed in our work, but we also know that you guys are doing awesome work as well. Active participation makes this, especially a virtual conference, much more enjoyable for us. So please don't put us on autoplay and go do laundry. We want you to pay attention and engage with us. Above all else, make the decision now that you're going to find something today, a nugget, a takeaway, a strategy, a tip that you can apply to your work immediately. Time is precious, so we want you to get something out of spending time with us today.
All right, so as you all know, we have been in the virtual world for about a year now, and most of the meetings that we have are very boring. And so what I like to do in my meetings or even in the classes that I have is to do an icebreaker. We all love a good icebreaker. So using your chat box, put which number corresponds with the meme that best represents how you transitioned in your work from in-person to virtual. So number 1, if you got it, you did a great job. Number 2, you just show up to get paid. They just come to you. Number 3, which is the one that I identify with the most, my therapist tells me to engage in self-care. Look at me, not engaging in self-care. And number 4, I'm dying. Please send help. So which one resonates with you? How did you transition? I see a lot of 3s. I see some 1s. Nobody put 4? Okay, good. We don't have to do any check-ins after the session if you put number 4. So definitely a lot of 3s, a lot of 1s, no 4s. All right.
All right, so for the most part, we all acknowledge we don't take care of ourselves very well. That's not new information. We know that. This space has been exciting and also challenging. And that's kind of what we're going to talk about a little bit, or what I'm going to spend my time today talking to you about. But we want to also kind of put in a little caveat here that we recognize that not all virtual therapy is conducted with youth in a home in the traditional sense. Some of you are working with youth in schools, in outpatient treating settings, juvenile detention centers, a host of other placements. I'm sure we haven't covered everything. However, regardless of the placement or setting, we know that virtual work is not without its challenges, right? It allowed a lot of our youth to stay engaged in this work, but it also represented some new hurdles, some new opportunities for us to kind of flex a new muscle. So let's unpack first some of those barriers to clinical success as it relates to virtual work with you. This list isn't exhaustive, but here are a few that kind of jump out at us. Constant threats to confidentiality and privacy, inadequate space, limited technological infrastructure or know-how, cultural, community, and developmental factors, and building therapeutic alliance in the absence of proximity. And I'm sure as you look at this list, you can find one or two of these that you've encountered in your transition from face-to-face work to the virtual space. According to Rotes and Hogwood, 70 to 80% of youth who receive mental health services access that care in the school setting. We know that the rates of mental illness among incarcerated young people are significant. Also, for youth, virtual counseling in the COVID era most commonly occurs in the outpatient or home-based setting. These settings increase access, offer youth the opportunity to be served in familiar and ecologically valid settings, but they also can be difficult to navigate. So beyond the normal limits to confidentiality, overcrowded classrooms and homes can make it difficult to establish privacy to maintain confidentiality. And I'll share an example here. I provide mental health support to a few Head Starts in the Houston area. And these children are physically present at school. They're going face to face. And I, of course, am present virtually. So in order to meet with my clients, I have to have another adult take me into the classroom using their device. Their presence, it presents significant threats to confidentiality. I also have to contend with the reality that there are not many spaces for the students to meet with me privately. So not only do I have to have the adult who was my legs walking me into this room, there are not many private spaces for my client to meet with me. That was an issue when I was there face to face, but now that issue is compounded. Let's just pretend we're not in the school setting. I have clients that live in multi-family households. So asking them to find private space for our work is essentially like me asking them to go pull a unicorn out of their closet. When you have 5 or 6 adults in a house with 5 or 6 additional children, there's just not a lot of space. And we can't hold up the bathroom for 45 minutes to do this work. So it requires some conversation about confidentiality with folks that used to not be involved in that conversation. And that's been an interesting transition. Let's talk next about community, cultural, and developmental factors, because they also deserve some consideration in this space. We may be located hundreds of miles away from our clients. And that's especially true in Texas, right? I can have a client in El Paso and I'm located here in Houston. I'm going to be unfamiliar for the most part with their community, their culture, service systems versus folks who choose to come to see me in a brick and mortar space. They likely searched their zip code and chose a place that is close to where they live. So now, in order to support that work, we have to familiarize ourselves with our youth's local community, their culture. We have to make sure we're familiar with common recreational activities, community events, local industries, employment, just key community supports, things that we may naturally know in a space where we're sharing space with clients, That may not be true when we're doing virtual work. We also have to think about use nuclear family and extended family members and other kinship relationships. We know they play a pivotal role, but when you're seeing clients face to face, the most interaction you're likely going to have is with the parent or guardian that brings that youth to your space. In the virtual world, you get to see grandmas and aunts and cousins, and that presents some additional complexities, but also some opportunities to deliver culturally informed and evidence based practice. I've had more dogs and cousins in sessions in the last year than I probably have had the duration of my career. Lots of younger siblings too. We also want to acknowledge that developmental factors play a role in kind of some of those challenges that we face in this space. We as grown-ups sometimes misinterpret or overgeneralize a youth's engagement with social media as its desire or willingness or ability to engage in these long virtual sessions, requiring youth to look into the camera at all times, or that requiring that they speak the entire session, or they be fully engaged for a full 45 to 60 minutes is a lot of times counterproductive. We don't have some of those tricks that we use. No, there are no sand trays in the virtual world, although we can get creative about what that looks like. It doesn't exist in the way we're used to having it. There are just some things that don't we don't have access to in this space, but that we have to acknowledge developmentally. It's really hard for us to engage virtually for that extended period of time. So how can we overcome those barriers? And that's some of the things that we're going to talk about during our time together today. Lastly, in terms of barriers, the therapeutic alliance is a super strong predictor of outcome in mental health treatment. This is what they teach you in graduate school, right? You know, the number one predictor of success is how well you're able to build rapport and build an alliance with your client. People will work harder for you when they like you, right? This is particularly important when working with children and adolescents. Our office decor, our snack options. We all know kiddos love snacks and they are judging us accordingly based off the snacks we have or don't have. All right, these are all metrics that youth are often using to determine how and to what degree they'll engage with us. But when you don't have the physical space, we have to get creative in establishing rapport and building connection. So I'll give you another example here. This is super simple, but one of the ways that I disarm youth is I'm really intentional about the clothes that I wear. I never wear a collared shirt, and I never wear the counselor cardigan either to the session, right? Because folks are home. They're not going to be dressed like they were at school. They're going to be in loungewear. And so I want to match how they're going to show up to me. There is an undeniable power differential that exists between clients and us, and that exists all the time, regardless of modality. But when you have the power differential and a literal screen in between as a barrier, you want to make sure you're being intentional about how do you disarm, how do you engage, how do you communicate relatability. And one of the ways that I do that is with how I dress in the session. And so these are the type of small changes that we can employ to kind of improve and extend our reach in the virtual space when we're working with youth. I'm going to give Jasmine now the opportunity to kind of jump into the topic of interventions. She has some really, really fun stuff to share.
Okay. Now that we've talked about some of the barriers that we face as clinicians across all of these settings with all of the populations that we work with, I wanted to take a moment to kind of dive into some interventions that may be useful for you to implement across your practice or whatever space that you're in. Go ahead, Dr. Chanta. So we cannot talk about everything that is creative and beneficial in the therapy space, but these are some that we discussed that would be important to implement. So we have the Chatbox, music, tangibles, and the one that I love also is the scavenger hunt. And I put this picture up here because this is what talk therapy used to be. So it's the therapist with the couch. I hope nobody's sessions look like this. But this is what it used to be in person, having the person sit across from you, being in the space, picking up on body language and cues. And now we don't have that anymore. So how do we get creative and meet our clients where they are? So, and we love client stories. And I also love assigning names to my clients that a lot of people know. So with the Chatbox, one of the barriers that this addresses is going to be privacy. And so, as Dr. Chanta stated, now that we're seeing clients at home or in different spaces, we have the issue of that space not being closed, not being able to close the door, and also everybody wanting to say hi to the therapist during that hour time that you have with your client. So what we have found that is so helpful is the chat box. And so I'm going to use Dr. Chanta as an example. I'm going to message her, and I want you all to let me know if you can see the message. Does anybody see what I just wrote? No. Thank you. And so this is a way for you to communicate some things to your client that they might not feel comfortable in the space that they are in. And so it also addresses the technology infrastructure. So we have to basically use what we have at hand to communicate and address our clients' needs at the moment. And so I have a 17-year-old client who watches her younger siblings most of the time when we're trying to meet. And so I'll ask questions about how are you feeling today? And so I'll get the blank face. And I'm like, okay, you don't want to talk. This is not working. So let's use the chat box. And so it feels like texting to them, but it's also a confidential space that we can have a conversation about things that she might not want exposed in front of her siblings or anybody else that may have walked in the session. And this can be used across all settings. So if you're in the detention space or if you're in treatment centers or schools, this can be utilized, and it's very helpful. Music. So this is one of my favorite interventions to use with clients. I use it a lot when I was working in person I use it with my adult clients. I use it with my younger clients that I see, but I had to be able to find a way to implement this virtually. And so I also love this intervention because you can utilize this in whatever space you're in. So if a client is on the phone, over the computer, or FaceTime, you can find a song, you can play it through the speaker, and you can use that as a therapeutic activity. And so in regards to addressing the barrier of developmental factors, this can be used to meet various needs for our clients. So they can get up and dance. They can be expressive in how they're feeling by using the lyrics of a song to kind of denote what their mood is or what their mood is not, or something that they experience. And I know I have a ton of client stories, but Dr. Chanta, can you share a story that you have worked with a client using music with?
Yeah, music is one of my favorites. I didn't mention this earlier when we talk about technological infrastructure. The fastest way to make yourself look old when you're working with youth is not know how to work your technology. And so you want to make sure when you decide to incorporate this intervention that you know how to play the song from some device that will work instantly, and you're not fumbling around. Issa Rae is one of of course, her real name is not Issa Rae, but she's a 13-year-old African-American girl, and she has a tendency to intellectualize, but she also has this very creative side that I often try to tap into to get her to express herself. And so one of the things that we do is I open the session each week with a different prompt. And so I often use music. So I say, tell me how your week, the last 6 days since we last met, conceptualize that for me in a song. I do not use the word conceptualize. Tell me what that means, right? Explain it to me. One week she told me to play a song by Tyler, the Creator, which I'm familiar with him, but not familiar with the song. And so the word that she used to describe how her last couple of days had been was chaotic. And the video absolutely expressed chaos. She's into really different types of music. And so we spent a couple minutes listening to it, but it always so beautifully and perfectly captures where she is. It's an opportunity for her to share something personal about her without having to use feeling words. It's also an opportunity for her to teach me something. We talked about that power differential earlier. It's an opportunity for her to be the expert of something and expose me to something that I may not personally know about. It's really important when you incorporate these things as well. If I'm not home alone, I do also always have an earbuds, just so nobody else can hear what she's sharing. I think we ask clients to protect their own privacy, but if I'm not home alone, I also put on earbuds and make sure that only she and I can hear what it is that she's sharing with me. So music can disarm, it can engage, and it's super easy to whip up a free song on YouTube after you listen to the ads play. So
yes. And one of the benefits, some of the benefits of utilizing music is that it disarms your client. So if you go in and you're very open to the type of music that they listen to, because sometimes I have gone into session and I'm like, let's listen to Adele. And they're like, no. And so it can disarm them by you kind of stepping into their world and listening to the type of music that resonates with them. It's engaging. So if you're using just audio or even YouTube videos or Apple Music videos, you can have your client, give them a task, like find what resonates with you in this video or what can you relate to. And it's available across most platforms. So you can use your phone, you can use the computer, whatever device you have available.
I will add one little tidbit about music. I'm intentional about not being judgy. The song that she chose when we were super cursy, we just let it roll. And so when you're thinking about interventions, think about your own comfort level. What are you okay with? Are you going to be clutching your invisible pearls if it's a little ratchet? So think about that whenever you are inviting them to participate in this intervention. It's fine by me, but assess your own comfort level because they will take it there.
All right, so the next one is tangibles. So does anybody have access to any cards or markers or a die right next to them? Anybody? No?
You can get out of your seat if you need to. It's not against the rules.
So Deanna says yes. What do you have next to you, Deanna? So markers and cards. So yes, perfect. Y'all are already prepared. And so if you have not yet tapped into your creative brain, the pandemic has definitely forced us to do so. And so you have to find what works and find what's available to your client. And I know when I first went into the pandemic, switching from in-person to virtual, I was like, I want to paint. I want my clients to be Mozart. I want to do all of this. And it's like, no, scale it down. Make it work for the space that you have. And so tangibles are definitely a creative intervention to use across virtual platforms. We have paint, crayons, what else? Uno cards, love Uno cards. Because with these, you can make them what you need them to be. Depending on your client, they will use them as, if you're using art supplies, they can use them as they need to. Mindfulness cards, those are perfect. Mm-hmm. With the cards and you have Uno, sometimes with clients, I'll assign an emotion to the color that we pull. So if you pull red, we'll assign it to maybe anxious or frustrated. And then with the playing cards, you and your client can come up with some type of game or structure it how you need. When you pull a queen, you have to speak an affirmation about yourself. And then with the makeshift cards, the client gets to create their own cards. And so they can make them whatever they need to, and you can use them in all of your sessions. And this is also one thing that I love, is giving my clients the power to drive. And so if they're making their own cards, they get to determine what we're going to use them for, how we use them during the session, and when. And also with the dice, if you roll, pick a number and attach a feeling. So if you roll a 4, I want you to tell me about a feeling that you had yesterday. So allowing them to kind of pick and choose what those numbers represent for them. And the lovely art supplies. We have markers, crayons, paint, and now I'm still learning how to use all of the tools on Zoom, but you have the Zoom tools and you also have writing utensils. So this is a way for you to allow your client to express however they need to creatively and artistically. And this addresses some of the barriers of developmental factors, the therapeutic alliance, and the community and cultural factors. And so I thought it was important to add the community and cultural factors, because sometimes when we are planning our sessions and we're like, okay, we're going to do this activity and my client needs to have this, you have to be mindful of what they have available to them. So when you take into account community and cultural factors, your client may not have access to the 100 count box of crayons or markers. They might just have a pencil. So you being able to address whatever activity you have in session, and also not making them feel as if what they have or the tools they have are not adequate enough to participate in your session. Mm-hmm. And this is a big point of meeting your client where they are, even virtually.
Yeah, that's perfect. When you think about modifications, right? I know this doesn't seem realistic, but if you're using Zoom as your platform, what are things that you have access to in Zoom that could overcome the fact that students may not have paper or pencil? What's a feature you could use in Zoom?
Whiteboard.
Yep. Whiteboard is you both can write on a whiteboard simultaneously. Let's say Zoom acts up, because sometimes it does, and you don't have the whiteboard feature. You could always take out a piece of paper at your house and let your client direct you on what they have you draw. Let them give you the directions. You give the prompt and they tell you, I want you to draw 2 lines or a box or circles or whatever that is. You don't even have to be really good at it. You just have to follow whatever directions that they give you. That's one option. Who has the playing cards? Was it somebody says, I use screen share sometimes and follow through with the client. I love that. Mm-hmm. Who had the cards? Was it C. Deadman had the cards? I'm calling you out, sorry. If you have the cards and you feel comfortable, would you pull a card and tell us what number you pulled?
I think she steps off.
Somebody else had cards too.
Someone had affirmation cards or Uno cards next to them.
Deanna had cards. Somebody else had cards. I promise it won't be anything super personal. I'm just using you as an example. Somebody was brave and said they have 6. Ooh, and somebody had 2 spades. Okay, so I'm going to give 2 different prompts, because you can do this lots of ways. The person that has 2, go ahead and tell us 2 things that you've learned so far that you can incorporate now. And the person that has 6, tell us 6 cool things about you. You can take time. You don't have, we won't wait and I'll stare at the screen while you do it. We'll move on. But 6 good things about you. And the 2, what are 2 things that you can use right now? Those are very easy ways. You can incorporate brain breaks, give kids a break. You can do 6 jumping jacks. You can do 2 push-ups. If you notice that you're looking at the ceiling a bunch and kids aren't paying attention, you can always use your cards to do lots of different things. So there are limitless possibilities with a lot of these tangibles that Jasmine presented.
And also, I know we try to be very creative when we're using these interventions. Sometimes cards are just cards, and you can definitely use them in the function that they were created for, because it's also important, just as like us adults, we don't like sitting in front of a Zoom screen for 2 hours with someone talking at us. We need brain breaks. So if you're playing virtual Uno, or if you're playing virtual, solitaire, those can be actual games to allow your students to breathe and process whatever you've talked about during your session. And also, I've sat in session and done virtually coloring. So I'll color something and then we'll share after 10 minutes of us taking a brain break. So you can use these things as what their intention for, but you can also be creative with them depending on your client. And the scavenger hunt. Raise your virtual hand if you have used this intervention. Thank you.
People. Tanisha and Rebecca, a couple people raised their hand.
Yes. So the scavenger hunt is definitely a very creative and useful intervention to use while you're in the virtual space. And I love saying that I am a non-traditional therapist. I like implementing things that are fun and that make sense for my client. And so sometimes when I mention this to other therapists, they're like, you have the client get up and go move around. I'm like, yes, because I would want to do that if I was sitting in front of a screen for a day for school. I don't want to do that for therapy. And so this is a great way to build rapport. It allows the client to kind of break up what they give and how they express things to you. So if however you decide to implement your scavenger hunt, you can do things throughout your session, or sometimes I'll start my session with, okay, we're going to do a scavenger hunt and I need you to find these 4 things. And they go find those 4 things, they come back and we talk about it. Or I can break it up in the way of, okay, overall during our session, we're going to stop every 10 minutes and you're going to find something on that list that we made for our scavenger hunt. Uh-oh. Sorry, my lights went out. And also it builds meaningful client experiences. So it allows you to kind of get in their space and figure out who they are as a client. And it gives the client the impression that you want to know more about them. When they're going to find these things on their scavenger hunt, you can utilize items that like, what makes you happy when you come home? What things do you grab when you're feeling sad? When you're having a blah day, find something. What is your first comfort thing that you go to? So having them bring that in gives you an idea of who your client is and how they respond. And on the therapist side, you're taking your clinical notes and saying, oh, okay, I see that they self-soothe with this when they're upset, or they could, benefit from utilizing this when they're having, a moment. And so also it answers the questions of who are you and how can I know more? Because if you're consistently asking them to find things that represent them or represent the space that they're in, it gives them the idea, like my therapist really wants to know who I am. She's very interested, or he's very interested in getting to know what my life is like on this side. Because like I said, we're all very used to being in the room and picking up on things that we normally can pick up on, but now we don't have that. We have this screen in front of us that kind of takes away that personable experience that we have with our clients. And this intervention addresses developmental factors. So you're having the client get up, they're moving, they're not sitting in one space too long. And it also builds the therapeutic alliance. So when you answer those questions, when your client is answering those questions of who they are and giving you more information about themselves, you're building from there. It gives them a sense of just personal experience. So like I said, my therapist wants to know what makes me happy, or my favorite room in the house, or, she wanted to see my closet. And sometimes our clients will open up a lot more from there. So next session, they're like, do you want to see my shoes? Or do you want to see what my mom made for dinner? Like, yeah, let me know what your life looks like on the other side of this screen.
In my experience with the scavenger hunt, I always join in. I think reciprocity is important. And so I have a client who one of her primary issues is body image and skincare. When you're a teenager, acne is real, and finding a routine or products that work for you is real. And so she asked me, when I gave her a prompt for the scavenger hunt, to also go get the things that I use on my face. And I can remember thinking, well, I didn't think this is how this is gonna go. But okay, I mean, it's not like I can't say I don't have them. Like, she knows that I'm at my house. So I go in my bathroom, I get the things, and we spend the last 10 minutes of the session talking about developing a skincare routine. Are those things that I've ever done in face-to-face settings? No. I mean, I worked in a middle school for for 5 or 6 years, I mean, there are lots of talk, and I hope that doesn't make anyone uncomfortable, but tampons and such, and those were always normal conversations to have at middle school. But I don't know if a client has ever asked me to go get things and show them how I use them, which was a really cool experience and an opportunity to kind of show her a little bit more about me without having to use self-disclosure in the traditional sense. And so there are lots of ways that you can facilitate this and do this, but you do want to make sure that you are engaging in some level of reciprocity, because we're asking a lot of clients to kind of extend themselves and show and tell, and then we're saving all of us for us. So think about your own comfort level, assess your where are you comfortable. I've seen a lot of dogs in the last year. I show my dog. I have a certified therapy dog. He's actually in the closet that I call his apartment right now. And sometimes I show him, and sometimes he does tricks, or I let them give the command over Zoom, and he will, perform it for them. So there are lots of ways to do that, but reciprocity is important. Don't forget that piece.
Yeah, and also with one of the highlights from using this as an intervention, it destigmatizes what our clients think therapy is. Mm-hmm. And so typically we're very used to that intake session of, tell me about why you're here, what are you doing, like how are you feeling, how do you self-soothe? And so this kind of takes away that uncomfortability of answering questions about themselves, because you as a clinician, you're picking up on certain things that maybe they wouldn't be able to say to you verbally.
Ms. Jones was super brave to share, but we'll wait to the end to share hers. They make me smile. We'll wait until we get to the application. Hers are super good.
Okay, so now that we have looked at the barriers and talked through some of the interventions, these are some things that we wanted you all to consider when you're wanting to implement some of these things in your spaces. I use the puzzle pieces for a reason, and they are mismatched puzzle pieces because not one size fits all. So something that you may be able to do in the school setting may not necessarily work in the detention setting, but it's about using your clinician creativity to make sure that your client is getting what they need. And so in some placements, you might not even have access to music or access to writing utensils or art supplies. And so you have to do the best with what you have to make sure your clients are getting their needs met. And that kind of resonates with the next one. Each setting and client population require different interventions. So some of my students that I work with at the school are not as high need as some of the clients that I have in private practice. So utilizing some techniques with one population or one client caseload more than the other may work, because that's where they are at that moment. And like we say all the time, and we hear this over and over, you're meeting your client where they are and addressing what they need in the moment. And also safety, making sure your client is safe, adjusting your terms of safety. So once we moved from in-person to virtual, we had to kind of recreate what safety in the therapy space looks like. And so that can mean a lot of different things. If your client is in a treatment center, the safety portion might look a little different. Like Dr. Chanta said, when she was seeing students at her Head Start, another adult would have to be in the room. So that may be the guidelines that facility has set up in regards to therapy and safety. And so when I work with clients who are at home, it might not necessarily be the same thing of addressing safety, but mostly you ask the client where their location is, and that could be anything. And also understanding home is defined differently for everybody. So home might be the treehouse outside, or going to sit in mom's car because that's the only space that you have by yourself. And so as a clinician, being just culturally aware and just respectful, just understanding that our definition of where they are or safety may not look the same as it was before. And also a big thing, there's always talk about the camera. Does it have to be on the entire session? Does it have to be facing in front of your client the entire time? I know when we were discussing some of these interventions, Dr. Chanta said that she utilizes a method in her sessions where in the beginning, the client has to show you their face, but throughout the session, they can put their camera on their feet if that makes them more comfortable, or they can show their arm so you could know that they're still physically present, but you're not having them sit in front of that camera the entire time of your session.
Okay, we're getting some really good questions now that we're moving to the application portion. If we can start on this part, and we'll answer the questions that are in the chat. Someone was courageous and brave, and I asked them to share 6 things about themselves. So I'm going to share them with the group. They're in the chat. My favorite is I talk in song lyric when I'm bored. You are so my person. It is what I do. Virtual scavenger hunts are the best thing thought of. 3, I'm willing to play online games with clients. I also like random dance breaks between sessions. I enjoy online tools because I'm not crafty and I like to bake. So if you'll unmute yourself and tell us what it was like to do that, because we're asking you to be the client, essentially, to play the client. Because you also add a little comment, that took longer than I thought. What about that took longer than you thought? Was it easy, hard to come up with something? What did it feel like to be put on the spot and be the client? Is she gone?
She might be. Also, Deanna put the 2 of spades, and she said the use of tangibles and how important confidentiality issues are. Those are great items to discuss. Oh, Miss Jones doesn't have a mic because she's an old computer.
No, no worries. We'll give you one more whenever you're ready to tap back in. We're going to ask more of you to be brave and share how you can apply some of what you have learned here today, or what something that we've left out that you're doing. Because remember, we started with your experts in your own rights, in your own spaces. If there are things that you are doing that you can share with us just really quickly for the benefit of the group. But I want to put out a disclaimer and put myself on the spot to say, sometimes you try these really awesome creative things with clients and they bomb. You are so excited. You spent 6 days from the last session planning exactly how you're going to do it. And they're going to be so excited and engaged. And it's like, Play-Doh. Thanks. And you low-key have an attitude, but you can't, because everything just isn't going to hit. And that's okay. But while we're talking about application, we just want to make sure that we acknowledge that we're sharing with you the high points, but we also recognize there are realistic pain points that exist when you're trying to be creative in this space, in this virtual space with youth who are incredibly honest.
Yes, and also the life hacks and things that happen when you're having a day with clients and your Wi-Fi is spotty and your sessions are going in and out, and having to deal with being creative on top of just in a space that we as therapists don't want to be in the first place. And so making sure that, you're being mindful and kind to yourself when you're trying to implement these interventions.
And people are putting some really cool stuff in the chat box. My neighbor loves Roblox. Cody said he uses Roblox with a few youth. It really shows anger and impulsiveness very quickly. I never thought about doing that. That's such a cool idea.
That's a new trend of utilizing video games in sessions and allowing your client to kind of lead and have it be beneficial for them, because essentially, like us adults sometimes hate the virtual space, but kids can find themselves hiding away there because it's safe. And so as a therapist, going to that space with them and understanding exactly what they're getting from that and what is coming out of it. And we had a question from Deanna.
Questions. A couple people shared a few more interventions. Somebody said, Alina Porter said, I asked clients to show me what they have on their bedroom walls. Nothing tells me more about who they are and what they're interested in than how they decorate their room.
Yes.
That's cool. Somebody says, when you were talking about not having to have the camera on, I work with adolescents and many of them have self-image problems. It's good to hear it's not a bad thing to allow them to not have their camera on. I have them have it on. I just don't have to see their faces. So I've seen a lot of toes, a lot of rubber bands being popped on pencils. I know it's them for safety purposes. I need to know who I'm talking to, but I don't have to see your face for 50 minutes. So I don't want to stare at my own face for 50 minutes. So it works out.
Yes. The question was, how do you address when clients or families are driving in the car? Do you cancel the session or do you continue? That is an awesome question.
Mm-hmm.
And so it definitely depends on your relationship with that client and the family and what you feel will be beneficial. So if you're canceling the session because they're in the car, then you have to take that into consideration. I know I've met with clients that I'll have them turn their camera off, but we'll still use the audio and I can hear them in the car. But I want to make sure that we're being accessible, because if the time you have those sessions is when mom is picking, or mom or dad or whoever's picking up the kid from school, you don't want to penalize the client because of that. That's their environment at the moment. So it's definitely still up to counselor discretion.
If my person is driving, and I do have teenagers that are old enough to drive on my caseload, the answer for me is a hard no. If you're driving, if they're a minor and they're in the car with someone else that is driving, my question then becomes about, are you comfortable enough to share and go there in that space where you're in a confined space with other people?
Mm-hmm.
And that's where we use the chat to talk about, is this a good time or should we reschedule? But if they're the driver, it's a hard no for me. If they are the passenger, then I let them have a little more say so in what that looks like.
Mm-hmm.
Miss Jones responded, and I asked her a while ago, how did it feel? She's the one who said she didn't have a mic, but I asked her how did it feel to be the counselor and be put on the spot to be the client. And she says it's awkward because as counselors, we aren't used to sharing things about ourselves unless we are asked directly. I'm naturally a really goofy, out there person and have to tone a lot of that down for some clients. It's become shocking when you're finally asked to let it out. I think you just hit on like a perfect place to kind of start wrapping up. This is not just a time to try new interventions. This is a time to try being a new, fresh you. Like
Mm-hmm.
we get trained to be therapists one way, but we're also not, in the sense, like think about how a hairdresser has flat irons and curling irons and all these other tools that they can use. Well, as therapists, we are the tool. And sometimes we have to sharpen that and tweak it. And we have to do lots of things to keep ourselves sharp. And so being yourself, I have found being myself more so in the last year than I have ever before, has made such a difference in the effectiveness of my work. And so I say all that to say, you got to be who you are in this world. I think more than any population, teens, youth, adolescents enjoy authenticity. And so I think that is the biggest gift we can give to ourselves and our clients. Probably the biggest way to close the gap is to be ourselves. And so let it out would be my suggestion. I think there are two more things in the chat. We only have a couple more seconds. You want to read the last two, Jasmine, from Mary and Lauren?
Yes, before we have you guys fill out the poll, Mary said that there's a lot of issues with clients who either don't want to or have their camera on as well, so it helps to have that normalized. It does make connecting with them more challenging, especially new clients. Yes, definitely. Getting to know your clients over this space, first session, is probably one of the most challenging things that I've had to kind of confront while working in this space. And so making the camera less big for the client will help them a lot to kind of open up to you. Mm-hmm. And Lauren says, I always open up the floor to let teenagers ask me questions about myself. Is there anything you'd like to know about me since you have shared so much about yourself? Yes, that definitely lands on the authenticity of allowing your client in this space, because I think sometimes we forget that the virtual screen is also a barrier in front of us, and we can kind of use that to tone down who we are or be expressive in what we want clients to know.
Last one, because it is 11:50. I think it's from Miss Shaw. You want to read that one, Jasmine?
I work with children and all of them are traumatized. Many of these children present with ADHD and they have concentration issues. So you use videos and cartoons to see what it looks like in angry moments, and about using 1 minute and 24 seconds. I think that's awesome. you are definitely being creative in your interventions on what you use with clients, and it looks like something that they understand. I hate the typical feelings chart, and so giving them something that they can respond to and that they see all the time and that makes sense to them is perfect. Thank you for sharing that.
Well, guys, our time is up. 15 minutes went by super fast. We hope that you took at least one thing away that you can use, and you won't go and tell folks that we wasted your time, because that wouldn't be good. If you will take a second and complete the poll, we would be ever so grateful. Thank you for sharing time and space with us today. We appreciate you guys.
Thank you so much.